right. Hello, everybody. Good morning. Dr. Rafich here, Vet Triage. It is September 30, 7:27 a.m. Pacific time. Let's do this. So we're looking at JAVMA, December 15, 2017. This one is going to be the characterization and comparison of injuries caused by spontaneous versus organized dogfighting. Very interesting topic. It comes out of Tufts University, as well as ASPCA, Southern Connecticut State University, and University of New Haven. So we'll go through this study. 36 medium-sized dogs were included in the study that were involved in fights with the dogs of the same sex and similar weight. Then they had 160 small dogs that were involved with fights with bigger dogs. And they had 62 dogs that were seized in connection with dog fighting law enforcement raids, so illegal crime fighting. They looked at the prevalence of injuries in all three of those groups and compared them. The end result, and we'll go through this in more detail, organized fighting dogs were more commonly seen with multiple injuries, particularly of the thoracic limbs, so the front legs, the dorsal and lateral aspects of the head and muzzle, so the face area, or inside the mouth, and the neck region. Those are most commonly seen with organized fighting dogs. So establishing evidence-based patterns of injury can help doctors identify dog injuries from organized dog fighting to aid in the prosecution of this crime. So what will happen in the veterinary field is somebody will say, my dog got attacked, I think. So maybe some dog ran to my yard, I didn't see it, and now he's got these wounds, and can you fix them? And we can't tell whether or not the pet owner is being truthful or whether that dog actually is part of illegal dog fighting. So organized dog fighting is a crime in which two dogs, usually of the same sex and similar weight, are fought until one dog is unable or unwilling to continue, the handler concedes, or on rare occasions, the dog dies. In addition to animal abuse and illegal gambling, dog fighting is often associated with organized crime, racketeering, illicit drugs, illegal firearms, and other forms of violence. As of 2009, dogfighting is a felony in all 50 states in the United States, and interstate movement of dogs for fighting purposes is considered a federal felony. In the U.S., a pit bull terrier is the most common breed, and that's because they have impressive strength, stamina, agility, pain tolerance, aggression towards other animals, and willingness or desire to fight despite injury or fatigue. And so those characteristics are referred to as gameness, when a dog will fight regardless of its own injuries or fatigue. And this is not to say that pit bulls are bad dogs, right? I mean, we all know that there are really sweet individual dogs of certain breeds and really aggressive ones. And so pit bulls are no exception. There are very nice pit bulls and there are mean ones. It's the way the dogs are in general. But those other physical characteristics make them appealing for dog fighting. Dogs are typically first placed in a controlled fight that serves as a training exercise, and that happens at approximately 1 year of age. This is termed rolling. It's done several times, and that repetition of controlled fighting is called schooling. Then they can enter a contract fight. And the dogs in the contract fight are matched by weight and sex. Both the male and female have value in terms of males being bigger, stronger, that kind of thing, but females, of course, being breeding stock. But really, both are valuable for breeding stock, because as the dogs are winning, they want to breed those dogs. And then the animals that lose the fight are either tortured or killed by the angry or embarrassed owners of those dogs. And this is all in illegal dog fighting. So during a spontaneous fight, meaning a fight outside of like purposeful, illegal dog fighting. So you're walking your dog in the dog park and their dog comes by and then there's a fight. We're going to call that spontaneous fight. Dogs with normal social behavior inhibit their bites and stop fighting when the other dog shows signs of submission. And signs of submission are whining, turning away, rolling over. And that happens all the time, right? The dogs are sniffing each other, and the one growls at the other, and then the more submissive dog shows submission, and then there you go, no fighting, or at least minimal fighting. In a previous study, in spontaneous fights, the injuries occurred over the scruff area, so the back of the neck, the shoulder, and the haunches. And only a few of those bites produced full depth puncture wounds from the canine teeth. That's a previous study. Dogs that are fought intentionally frequently have wounds on the head, forelegs, and chest. They're usually numerous wounds, they're usually more severe, they're deeper. There's avulsion of the skin from the underlying tissue and underlying fractures. Avulsion is where the skin, the top portion, is removed from the deeper portions. You'll see that a lot of people watch like a bear video where the bear is attacking something and it's doing this twisting motion. It's pulling the skin away from the underlying subcutaneous and muscular layers. So the prevailing theory is that dogs used in organized fights are bred and trained to have reduced bite inhibition, inflicting maximum damage on their opponents rather than only driving them away, and to continue to face their opponent and fight in spite of their own injuries. Such dogs may have wounds present that are in different stages of healing. And that makes sense, right? If you see a dog at a vet office and it's got one very fresh wound and another wound that's kind of healing and a whole bunch of old scars, that's very suspicious. So this study was done mainly by Tufts University between January 1st, 2003 and June 1st, 2014. There's a bunch of, I'm not going to go into their exclusion criteria. There's a bunch of them that they base on whatever information was available medically to them. And so, of course, some dogs had to be thrown out of the study because the records were incomplete. But those are in the paper if you're interested in that. So what they did was they took the body surface of a dog and they divided it into 51 sections. And then of those 51 sections, they were assigned a value. The value of number 1 was if there's a wound or a scar present, and 0 is if there's no wound or scar present. And then what they did is they took the 51 sections and narrowed it down to 13 big zones. And so that's in this picture here of this dog. You can see there's 13 zones there. And the numbers, the 1 and the 0s of each zone were added up. And that's how they compare the different zones of trauma. So the zones were, for zone 1, the head. Zone 2 is the eye. Zone 3, ears. 4 is the muzzle and inside the mouth. Zone 5 is the top and sides of the neck. 6 is the ventral neck and thoracic regions. 7 is the shoulder region. 8 is the front legs. 9 is the thoracic and lumbar vertebral regions of the spine. 10 was the side of the chest and abdomen. 11 is the bottom part of the chest and abdomen. 12 is the hind legs, and 13 is pelvis and tail. Okay, so results. What they found was there's 160 dogs that were involved in the big dog, little dog fights, and 40% were castrated males. 33% were spayed females. In the medium-sized dog fights, 30% were castrated males and 58% spayed females. Of the 62 dogs involved in organized dog fighting, 51% intact males, 48% intact females. Way bigger numbers there. As far as the breeds go, for the big dog, little dog, most dogs were Yorkies, Chihuahuas, Shih Tzus. In the medium dog, they were mostly Pit Bulls, Beagles, Australian Cattle Dog. And in the fight, the organized dog fighting dogs, they were Pit Bulls. All of them were Pit Bulls. The age for the big dog, little dog was 6.3 years. The medium dogs were a little bit younger at 4.7. And of course, the organized fighting dogs, younger, even more so at 3.4 years of age. And then in terms of the, we'll leave all that stuff alone. They have more information on differences in weight and body condition score, but it doesn't really matter for us. Okay. So when they looked at the 13 body zones, the big dog, little dog had most injuries, most common injuries were over the spine area and the side of the chest and abdomen, as well as fractures of the ribs. Okay. In the big dog, little dog, the side of the chest and abdomen area made up 35%, and the top and side part of the neck made up 26% of the cases. With the organized fighting dogs, the front legs were most often affected at 96.8%, and then the parts of the head, 93%. The muzzle inside the mouth, 88%. And then medium dogs, ears were number one at 44%. The top and side of the neck was 41%, and the front legs 41%. So they organized them by drawings here. So the top picture is big dog, little dog. The middle one is the crime dogs, and then the medium dogs are on the bottom. So you can see how the difference in distribution. And the reason why this is important is because when a dog comes into the vet with wounds, the veterinarian may be able to tell based on these patterns, what is this owner telling the truth? Was it really a spontaneous fight, out in the dog park or in the yard, or are they actually involved with illegal activities? 8 zones were affected in over 33% of dogs who were involved with organized dog fighting. Only 3 zones were affected in over 33% of dogs with the medium-sized dog fighting. In addition, missing, loose, or fractured teeth were seen in 40% of dogs in organized fighting, but 0% of dogs in medium fighting. So more evidence of the differentiation between those 2 causes of fights. Organized fighting also resulted in more injuries than the other dogs and had more injuries, not just in total, but within each zone. All right. So just to recap here in their discussion, the big dog, little dog, the side of the chest and abdomen were very common, the most common, and then the parts of the neck were second most common, and third was the eye. And that is thought to be because in a big dog, little dog fight, the larger dog grabs a small one by the midsection and shakes them around. And so the thought there is that you'll get injuries of the neck area, like we said, as well as rib fractures because they're grabbed around the midsection. And then with the violent shaking, intraocular damage occurs. So ocular damage occurs because of increases in intracranial and intraocular pressure. It's basically whiplash. And that's why those injuries happen as they do. So for the big dog, little dog, again, the side of the chest and abdomen, as well as fractures of the rib cage, and then the spine were all issues. Dental injuries occurred with organized fighting, like we said. In organized fighting, the thoracic limbs, like we said, the front legs are most common, and then the head and then the muzzle. The breeders and handlers frequently describe their dogs according to the behavior. So where the dog attacks another dog in dog fighting is taken note of. So they'll call dogs head dogs, chest dogs, or leg dogs. So if a dog attacks the head, mostly it's a head dog. If it attacks chest, it's chest dog. And so that makes sense with the distribution of injuries that they found in this study. In the medium dogs, the ears are most affected, then the neck, and then the front legs. And it was originally thought that most of the injuries occurred over the scruff, shoulder, and haunches, like we said earlier in this video. So it's a bit different here. However, they do admit that the selection criteria here may select for dogs with those types of injuries. So for example, on vet triage, musculoskeletal injuries make up, if not top 3, top 5 most common body systems that we see. And of those, a lot of those are bite wounds or wounds for any reason. And most of them either don't need to see a vet or at least are not emergencies. And because this paper is based on Tufts University, which is all emergency, or most likely to see these cases, you're selecting for those wounds of specific distribution, severity, because the other ones would either stay home or those dogs would see their family veterinarian, and then Tufts would never hear about it. In one study of inter-dog aggression, owners sought veterinary treatment for their dogs after being in one or more fights in only 50% of cases. And that makes sense. I would say probably on vet triage, it's like 80%. We recommend not going to the emergency hospital and to see your regular vet when they're open again. The other inclusion criteria that may have affected their data is that the dogs involved in big dog, little dog, and in medium-sized dog fights were from Massachusetts. That's where Tufts University is located. But the dog fighting dogs were from southern United States. So it may not represent the entire population. That's the point. A study of A previous study of household and non-household aggression between dogs concluded that fights between housemates were more intense and resulted in more serious injury than those that did not live in the same home. Dogs involved in spontaneous dog fights have different patterns of injury than those seized from illegal organized dogfighting operations. That's the conclusion of the study. Organized fighting dogs have multiple injuries as well as a higher prevalence of injuries, particularly of the front legs, the head, neck, and thorax. So yeah, that's the study there in JAVMA. Hopefully that folks found that enticing, and tomorrow we'll hit up another paper in the same journal, and we're almost done with this journal. So thanks to those who watch on the playback, and we'll see you in the next one. Take care.